This resilience center, as I said, is focused on climate adaptation, and we've set a goal of reaching 1 billion people with resilient solutions to climate impacts by 2030. And we specifically work on heat. And as has been said, it's the #1 killer of climate impacts, silent killer, more than any other climate hazard. And it's quiet and it's not dramatic. It doesn't have an agency that owns it. It doesn't have a name. It does not have a season. And the 1,000 plus death toll from the Pacific Northwest heat dome is remarkable. And as I've seen by Chris Eby, called a mass catastrophe event. And that's what this is. And that is the US in a developed context. And it's quite stunning. And so we have made it our mission to bring the actionable awareness and solutions to extreme heat through the build of a global coalition of which Greg Wellenius is a member and a leader in, and through some specific interventions and actions that I want to tell you about. And I want to make sure we can follow up for those who are interested, but the chief heat officer in Miami, Jane Gilbert, is our partner, and it is our organization that launched the chief heat officer concept in Miami. You see that proliferating, which is wonderful. And we have one in Athens and one in Freetown, Sierra Leone. We just announced the metropolitan region of Santiago in Chile, and we have one coming up in 3 weeks in Mexico and next to Oceania. And so we want to have one as a representative on every continent this year. And what comes with that, the symbol of the single place that sits very close to the leadership of a community, with a heat health task force and all the tools that you need to understand the size and the nature of the heat risk and impact, starting with the most vulnerable communities. We have built out of the Extreme Heat Resilience Alliance 4 working groups that capture the highest priorities from the community, from the incredible work that already exists and has been going on for a very long time. And we want to give it the oomph and, pardon the pun, put some fire under all of it because of the urgency that it faces. And, you know, the show Game of Thrones, winter is coming. I'm getting rid of that and going with summer is coming, but it's not summer. It's really heat season is coming, and it's coming on this side of the planet, and still happening in the southern hemisphere. And so it's happening every day, all the time. And the faster we can do this, more quickly we can do this, the better. And so those categories are building awareness for decision makers linked to vulnerable people. The awareness piece is the gap is so remarkable, which I know you all are well aware. The second is good policy. We've contributed to legislation that's been filed in California that is categorizing heat events, naming a chief heat officer for the state of California. That's Assemblywoman Luz Rivas and her partners and co-sponsors there. And we are excited to see that opportunity for more legislation at the local level. There's some things happening in Miami-Dade County around worker protection. We're understanding the economic impacts to bring policymakers into the issue. We partnered with Vivid Economics to assess the cost of worker productivity loss to the US economy. And in 2020, it was $100 billion, doubles by 2030 to 200, and then to 500 billion to $500 billion by 2050. And of course, those numbers and that loss is not borne equally. It is borne more by the southern states of the US and by people of color and by Hispanic people working outside. And so we are now underway on a 13-city analysis of mortality and economic losses due to worker productivity impacts of heat, and we'll be rolling that out in June. And so a good look across the globe, very different cities: Dhaka, London, Delhi, Freetown, Athens, Monterrey, Mexico, Abu Dhabi, Santiago. I think you get the idea. Very different. Bangkok. And so back to the categories: policy, talked about that. Risk and finance. How much does it cost to have a heat event, get ready for one, recover from one? We don't have the data that we need to fully understand that. And can we bring the understanding along with some financial strategies that don't tap the coffers that are already so stressed from COVID and everything else that's happening right now? And so we're working on understanding how we can deploy finance and risk transfer to help communities deal with this. And then lastly, interventions. What can we do? Lots of things we can do. Green roofs and cool roofs, and the things that you saw in the first two presentations, urban forests, cool roofs, change the design. We know that the urban heat island effect is not helping the way we've built and are continuing to build our urban areas. So lots we can do. And we are beginning to put a concept of a capital stack of investment into things that cool communities. So we can do it at scale, aggregate projects across those 13 cities. And so it's early days, but go from awareness to understanding it, to measuring the risk, to identifying where the most vulnerable are, and then identifying those interventions, and then attracting capital, and all toward the COP27 in Sharm el-Sheikh, Egypt in November. So we're in a hurry, and summer is coming.
So the other element, and I think the other very interesting research program that I've been able to learn and enjoy in collaboration with my colleague Abiu, is really to looking at the health impact of heat warning systems. So when we're dealing with protecting our health with climate change related disaster, so what type of intervention work? What can we do? So Kate Weinberger, who is a member of the team in the lab with Greg Wellenius, so she's been conducting a very successful research of looking at the health impact of heat alert system. And quite disappointing, she found in this really interesting work that heat alert were actually not very effective in lowering the risk of that. Were somewhat effective in lowering the risk of hospitalization for heat stroke. But again, there was not really, actually, I'm sorry, let me say it back. Not they were effective, they were the opposite. They were associated with a higher risk of hospitalization and heat stroke. So basically, what's going on here? So are these really heat alerts not useful and actually could be harmful? And so this is part of a very interesting investigation that is led by Zhao, who again was, as a member of the team led by Greg Wellenius on a joint grant that we have together, which is really try to address from a causal inference perspective, how many deaths we could have been avoided if we change the frequency of heat alert. So actually, this is in the context of really data science and causal inference, is in the context of what we call stochastic intervention. By stochastic intervention, what we mean about is really an hypothetical intervention. So basically, what we want to answer the question is, how much more often do we need to increase the number of heat heat alert to see a protective effect on health? So Zhao is leading a paper where basically I can just show it. It's highly technical, and I can show you with data, right? So basically, what this picture shows, these are the heat. With the blue cross are identified days where they were issued heat alert in Los Angeles County during the period 2006 and 2016. And so what Zhao is doing within a highly rigorous causal inference framework and a stochastic intervention is asking the question, okay, now if we think different counterfactual, so different alternative hypothetical scenario where we increase the number of heat warning how are we going to see an health impact? So this is like an hypothetical counterfactual where you see that, the number of days where we are issuing an heat alert is much more frequent. And what is finding, for example, when it does a county-specific analysis for many different counties in the United States, then in some counties, this heat warning alert can be more effective than others. So for example, in the Maricopa County in Arizona, we need to, if we increase the frequency of it alert substantially up to an odds ratio of 2, you see that you start seeing a positive effect on preventing number of deaths. That would be much less effective in New York. And that is really important because it's not only to address the question, how many more heat alerts do we have to have, but also that, as we all know, there is a differential heterogeneity and vulnerability across the United States in our ability to respond to this heat warning system.
This is a graphic from the recent Surgeon General's report on the mental health well-being of young people. And I share it because we are in the midst of a crisis now that's fueled by many things, COVID being a very strong force, the isolation and the anxiety associated with COVID. But this is just a graphic showing the different contributors that are coming together to affect the mental health, especially of children, young adults, adolescents. Notably, it's hard to see, but when we look at the environmental factors, climate change and natural disasters are for the first time noted by the Surgeon General as being an important aspect of the stressors that are contributing to this mental health crisis we're in. So just another piece of what's going on. But, I also want to look at the top box and just note again that the mental health stressors affecting children are compounded, and there's intersectionality with the stresses that would accrue from social economic inequality, from discrimination, racism, from the migration, which is a secondary effect in many cases of climate stress, as well as political upheaval and just economic opportunity. And then, of course, in the bottom at the individual level, we have individual vulnerability factors that are intersecting there, ranging from race and ethnicity to gender and sexual orientation. So all of these things can be cumulative and intersectional in causing these health effects. And we have to think about, what do we do today to be able to make those individuals resilient in the face of these compounding stressors. And this is just another depiction of this. Again, a slide borrowed from colleagues at the CDC. And I just share it. I'm not going to speak to it. I just spoke to it really, but showing that what's going on in terms of who is suffering the most from current climate variability, the recent Asian immigrants in the basements, the indigenous people in the Northwest who lost the cockles the clams and the cockles from the heat wave that killed millions of crustaceans and seafood on the shores. That's part of their cultural identity and part of their food. That this vulnerability is grounded in the same thing that we've been talking about for decades with environmental justice, with where people are in many cases not given choices, where they have to end up living for economic reasons, where things are sited in their proximity, where the investments are made in their communities, and then the root causes in those social forces. And I'm just going to keep going with this and share an example, again, a visual example for the visual folks in the audience. There's been a lot of study in the last few years about the systematic nature of financial discrimination that's known as redlining. It comes from the practices of something called the Homeowners Loan Corporation, which worked with the federal government to create over 200 maps of urban areas in this country in the 1930s and 40s, in which neighborhoods were outlined and graded on a 4-color scale based on their financial risk. Green being the lowest financial risk, red being the highest, and yellow the second highest. And so the practice of drawing lines around neighborhoods and then shading them red was called redlining. And it is easily demonstrated that the areas that in the 1930s and 40s that were designated as high financial risk were disproportionately lived in by recent immigrants, by African Americans, by Hispanic Americans, and other people of color. And there's a wealth of epidemiology now showing that those areas that were redlined, which the immediate economic consequences were deprivation of low interest loans, often not able to get mortgages, systematic lack of investment in infrastructure, et cetera, that those areas are now found to have higher rates of most chronic diseases, preterm births, et cetera. And this is just a depiction of the city of Richmond. You can see to the northwest, to the left there, that's mostly green and blue. That was the wealthier white area. The eastern part there on the right side is redlined. That was the predominantly African-American part of Richmond. And an analysis has been done from a climate change standpoint. So this is a map showing the green cover. And you can see that the left side there, the west end, has a darker green coloring, indicating more green cover. The right side has more impervious surfaces, which not only are heat trapping and radiating and causing higher temperatures, but also affecting runoff, wastewater overflows, water quality, and flooding. This is a map actually showing paved surfaces, showing the same thing. Lighter color, less paved surfaces in the green area, darker gray, more impervious surfaces in the red areas. And this translates into the average summer temperatures, which are blue, cooler in the green lined areas and red in the red lined areas, indicating greater exposure to heat. So just one manifestation of a link between social equity, climate change, and health equity.
So in 2006, there was a proposal to site a dirty diesel peaker power plant on the banks of the Chelsea Creek. The very same proponent who was proposing clean, renewable energy for Nantucket was proposing a dirty diesel power plant on the banks of the Chelsea Creek. That company, Cape Wind, was not telling anybody that they were proposing this dirty diesel power plant on the banks of the Chelsea Creek. And yet when residents got wind of this proposal, we started to do everything in the organizers' playbook. We protested. We showed up at their offices. We wrote letters. We had children writing to politicians. We engaged pro bono attorneys and licensed site professionals. And one of the most important things that we did was we partnered with folks at the BU School of Public Health who helped us to really understand and synthesize these large technical reports about air quality and what they were essentially masking when they were saying, we're not really going to be polluting that much. The folks at the BU School of Public Health helped us to dig through those reports to see actually they're lying about their numbers, and their numbers are much more significant than they're showing. And ultimately, we were successful in stopping that power plant. And so this is what the playground looks like right now, without those horrible stacks looming in the background. Now our children who are at this public school in grades 1 through 4 can play without worrying about hazardous, the addition of new hazardous air pollutants in our community. We're seeing in communities like Chelsea that have so much impervious surfacing, so little green space, such a low tree canopy cover, so much density and so much vehicular pollution that as the temperatures rise, communities like Chelsea are getting hotter and hotter. Studies show that communities like Chelsea have upwards of 40 degrees hotter neighborhoods, areas than in other communities. One of our young people also doing community mapping showed that he took the temperature of a park bench just last year. It registered 130 degrees in some of our most utilized parks. How could we possibly close our eyes to these long-term impacts of heat and heat island impacts, which only exacerbate public health, cardiovascular disease, respiratory disease, and more, dehydration. And so we've been partnering with the City of Chelsea and the BU School of Public Health on a project called Sea Heat. And what we're essentially doing is we're monitoring outdoor temperatures, but also monitoring the impact on individual folks. what do you feel like when it's hot? Where do you go? How do you experience heat? Where we have personal monitors with folks, and we're also using photo voice to have folks take pictures of what is it like? What does it mean to them? Where are they when it's hot? Where do they go when it's hot? What do they see? What do they feel? And this map shows you some of the emerging heat islands. So we consider all of Chelsea a heat island, but even within Chelsea, there are neighborhoods that are hotter than others. And so one of these heat islands just underneath the Chelsea map, if you could see my cursor, I'm sorry, just over here, we're actually implementing a coal block strategy. Oh, sorry. Forgot that this is animated and shows you all of the heat sensors. But we're implementing a cool block strategy, and we're, again, taking this sort of as a pilot. We're taking one block and intensively implementing strategies. We're doing tree planting around the entire block. And if anybody is in the Boston area and interested in joining us, we're starting tree planting on Earth Day, April 22nd, with a group of volunteers. And if you're interested in joining us the next day, we're doing a community cleanup on the 23rd, so you can message me for more information. But essentially, we're putting block-wide tree planting. We're looking at the Boys and Girls Club and partnering with them to install a white roof. And we're reimagining this lot right here, which is right now partially paved and partially just underutilized sort of gravel. And together with the community, we've come up with designs and visions for what this site will look like when we turn it into a lush green space. And so we're monitoring the before and the after to show, hopefully, that our theory is correct, that this block will be much cooler after this intervention is put in place. And we're very excited about this project, again, partnering with BU School of Public Health.
This 3-city project was focused on understanding how housing characteristics influence heat to better understand health impacts and adaptation behaviors of vulnerable populations across 3 cities, particularly during a concurrent heat wave and electrical blackout. So this project entailed some complex modeling and collection of data from residents living in all 3 of the study cities. And our group in Michigan realized that the best way to effectively collect the data and also impact change in Detroit, which is one of the study cities, was to engage with community members. There was no other way to get the project going. So we adopted a community-based participatory research approach, and I list here some of the key principles, and others have talked about that. I particularly appreciated Roseanne's comments. But the idea of CBPR is that you have an equal partnership between community and academic participants with power sharing and discussion of what's being done. You assess the community strengths that are brought to the research and the dynamics that might affect the research and application, identify priority public health issues and research questions, and design research together, and then importantly, feeding back and interpreting research findings and disseminating and translating that research into interventions and policy.
The last thing is empowering communities to advocate for their priorities. So, some of the things we've learned is that to create healthy living environments requires support and action from scientific and professional communities. And so it requires partnering with communities and trying to live out their vision. They want trees and parks, not just for cooling, but for beauty. And they want a clean flowing river. They want to meet basic needs for safety and food and housing and protection of civil rights. So we learned it's not effective to talk to the neighborhood only about organizing around climate change, as we heard in the last presentation. So I think that, these are really good lessons that all of us need to learn about the top-down, bottom-up cooperation. And finally, and in conclusion, I would say that I see the challenges now to addressing climate change are having the motivation and making the political choices to use the knowledge and technological tools we have to reduce structural and social inequalities, and meeting the basic needs of the communities is really what will dictate the human health consequences of extreme heat and other hazards in the foreseeable future.